Good morning, everybody. Welcome to the April 1st, 2021 Anchorage Emergency Operations Center operational update. This is Dalton Benson, the acting planning section chief. Just a reminder, drive the decline, wear your masks, and get your vaccines. We will start out with the situations update.
Good morning. This is John Cecil, Information Management Specialist. For Anchorage, cases total 27,908, an increase of 334. Deaths remain the same at 164. And hospitalizations total 746, an increase of 12. For 213, resource requests filled and satisfied 1,720, an increase of 5. And open and working 14, which is a decrease of 5. For non-critical transports, 43 over the last 24 hours and 4 after hours. For sheltering, total congregate 412 clients, a decrease of 6. Total non-congregate 341 clients, addition of 1. Total all shelters 753 clients, a decrease of 5. And 2,259 meals per day. Next slide, please. For testing, 917 sample collections, 83 per hour. For vaccines, as of March 31st, Dempsey 2,393, an increase of 113 doses to date. Blood Bank 6,379, an increase of 195. Shiloh 922, an increase of 52. Visit 742, an increase of 27. And Anchorage Dempsey is Alaska Airlines Center, 4,196, an increase of 105. Total all pods 42,355, an increase of 492 doses to date. End of report.
Moving on to operations.
Good morning, everybody. This is Rick Meredith, your operations section chief, with today's brief. For our mass care branch, we currently have 19 projected discharges out of our Q&I through Sunday and 6 today, and we've had 56 folks through our warming tent. Our mass care has seen a little bit of a decrease, and this is traditional what happens at the beginning of every month. And as we look at spring and breakup and going into summer, it's an anticipated norm. So we will track how many people decide to go out and explore outdoors and be prepared for what goes on later on this month as they come back into some of our sheltering system. In our public health branch, on a positive note, we have an increase of 2.57 over the previous Wednesdays, and our positivity rate, while it is at 3.10 for a 7-day rolling average, has gone down a little bit, and we keep encouraging it to go down. The more testing we have, the more our average goes down. So that's a good thing we're trying to see in our community. For our pop-up testing, today it's at UAA at Wendy Williams parking lot. On the 3rd, it's at Muldoon Elementary, and on the 5th, it's at 800 K Street. All those times are from 08 to 1900, Monday through Friday. In our medical countermeasures, one of the big things we're really looking at is expanding our walk-in capabilities. We've seen a better turnout in some of the walk-ins, though it is harder to predict for our vendors. So starting today at Diamond Center from 10 to 8, we will have appointments and limited walk-ins, but we will start increasing walk-ins at all sites again. Our mobile teams to continue to serve those in need. If you need that service, please call 907-531-5100. Fairweather at the Alaska Airlines Center is now accepting walk-ins and are partnering with Conquer COVID Coalition to bring clinics to businesses and workplaces. Our MCM task force is providing vaccinations to homebound. Again, use the same number, 907-531-5100, and we're working at partnering with our critical infrastructure vaccine clinics going forward. None of this is April Fool's, so don't get caught like I almost did this morning. Everybody have a great week, and encourage everyone to test and vaccinate.
Logistics.
Hey, good morning, everyone. This is Scott Carpenter, the EOC Logistics Section Chief. I don't really have anything significant to report from the last meeting that we had, but I will say that the preponderance of resource requests we have been receiving were for medical countermeasure support for the vaccination sites, as well as the EOC support for staffing, and happy to report that we're just about complete with filling the staffing request for the EOC. And again, a reminder at the bottom of the screen, although we do not have a PPE warehouse anymore, we still are taking PPE requests and test kit requests through the information provided at the bottom of the slide. Pending any question, that concludes the logistics.
Finance.
Good morning. This is Carrie Wiedeker, Finance Section Chief reporting. Currently, the EOC has encumbered $21,424,763. Our actual spent to date is $43,399,666 for a total of $64,824,429. As always, please continue submitting any invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery in the form of FEMA public assistance. If you have questions about that, please contact aaron.zachary@anchorageak.gov. End report.
All right, thank you, Finance. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. So this is how to talk about COVID vaccines with friends and family. There's still a lot of concerns and stress regarding them. So listen to their questions with empathy. Try to ask open-ended questions to explore their concerns, and try to avoid saying things like, that's a silly concern, or you shouldn't be worried about that. There are still a lot of questions about the efficacy of the vaccines out there. So try to put their mind at ease. Ask permission to share information with them. So you're not bombarding them, but giving them good information, real information from CDC and other reputable sources, so that they can explore themselves and help them find their own reason to get vaccinated, so they can be around kids without having to be worried, grandparents, family, friends, their own parents. So instead of having the conversation of why not get vaccinated, ask them to find a reason of why they should, and help them make the vaccination happen. If you need to book it for your elderly parents or family members or friends, go ahead and do that for them. Take them if they ask for a ride, and just make sure that they're being safe while doing it and they have all the information they need. Again, by talking to them and giving them reputable information and not passing along fake news. End report.
Thank you, Safety. Public information.
Hey, good morning, everybody. This is Kel Casey for the Emergency Operations Center PIOs. Our social media is focused on promoting the Do It for Summer campaign, testing and testing locations, vaccine efficacy, and we're boosting posts as well. Our PIOs are visiting Shiloh and Diamond Center today to gather content and interviews to help us overcome vaccine hesitancy. We're meeting with the Anchorage Health Department information officers today, as well as Ivan Moore, to go over his survey data so we can inform our media buys and our social media boosts. We have some translation service funding completed yesterday, which will help us get more flyers out to our underserved and English as second language community members. Our daily email outreach blast is going out every morning, and PIOs Calais Rupp and Laura Atwood are working closely with Northwest Strategies to target ads to help underserved, disadvantaged populations find out about vaccine opportunities, and those are showing up on radio, smart devices, browsers, all over the place. End report. Thank you.
Liaison.
Good morning. This is Celeste Prescott, the liaison officer for the Anchorage Emergency Operations Center. I'd like to thank all of our partners who were able to join us today. And is Kristen on for the Alaska Native Medical Center?
Good morning. This is Kirsten Cole with ANMC. This morning we have 4 positives, one of those in the ICU. We have 1 PUI and no patients on a ventilator. End of report.
Thank you, Kirsten. And I believe Sean is on for Alaska Regional Hospital.
Alaska Regional Hospital currently has 6 COVID positive patients, 5 of whom are still in isolation, 3 in the ICU, 1 vent, and 1 on BiPAP. That's all I got.
Thank you, Sean. And is Michael on for Providence Alaska Medical Center?
Good morning. We have 11 positive COVID patients this morning, 2 of which are in the ICU, 1 on vent, and 7 patients that have recovered.
Thank you very much. And do we have anyone on for 673rd Medical Group?
This is Sergeant Hatchell covering for Captain Auerbach, NSTR.
Thank you, Sergeant. And Matsu Regional Medical Center was unable to join us today, but they are reporting out 12 positive cases, 6 in the ICU, 4 on ventilators, and 0 persons under investigation. And that is all for the liaison. Thank you.
Thank you, Liaison. Command.
Good morning. This is Incident Commander Bob Dole. I wanted to do a shout out this morning to the Anchorage School District. I know Ashley is here on behalf of them, and specifically commend the testing protocol they put in place to address an uptick in positive cases in the hockey sport. I think it reflects a great way to keep the schools open while going back to the basics of testing and protective measures to do what we need to do. Outside, they're talking about the fourth wave of rising case numbers, but those protective measures are a great way to stymie that, and a great way that ASD found to keep hockey going, keep the schools open, and go back to the basics. End of report.
Thank you, IC. Thank you, everybody, for your reports. And the next operational update will be April 5th at 10 a.m. Thank you.